Good evening. I'm Peter Kern, the Director of the Global Public Health Program. It's my pleasure to introduce tonight's speaker. First, I want to thank the Institute for Health and Humanities, who co-sponsors the lecture series with us, and MCAT for their grant that allows us to videotape the presentations and then post them for you to link up with them and see it again, or tell your friends who missed it tonight to go and hear this amazing lecture that we're going to hear from Michelle Sayre tonight. So Michelle is an MSN RN. She's dedicated the majority of her 40 years of professional life to improving health in rural and resource-poor communities. She founded Nurses for Nurses International, a foundation which works to close the gap between disparity and inequity in healthcare in rural and resource-poor communities in Haiti, Montana, Mongolia, and Nicaragua through the skill, knowledge, attributes, and strengths of the world's largest professional healthcare workforce, that is nursing, the profession of care. So please join me in welcoming Michelle Sayre, who's also a member of the External Advisory Committee for Global Public Health, which sponsors this lecture series, to tonight's lecture.
Thank you. Well, thank you very much, and thank each of you I want to thank each of you for being here. I think it's later in the evening. You've probably had a pretty full day, and Peter and the Advisory Committee and MCAT and the Center for Humanities, thank you very, very much for this opportunity. Can I ask how many of you actually are in a public health track? 1, 2, okay. Oh, yay, good. Other healthcare tracks? What?
Nursing.
Oh, yay.
Yay.
Yay, okay, good. Well, thank you again for this opportunity, and Kelly, thank you for getting me set up and for the opportunity to be here. So I'm taking a little different approach. I am going to share with you the work that we've been doing in Haiti and see if there's something there that piques your interest in the approach that we're taking. But I'm going to kind of engage, as some of you may know, things are a little rough right now in Haiti. And our team that was planning on going, we're not now, and we're having to adjust some of our work. We just were talking tonight, and then we had a meeting. Thank goodness for Skype and Zoom and things. We can stay connected while they may not have fuel, and things. A gallon of fuel right now in Haiti is about $12 or more, and if you do go out, it's considered kind of a betrayal. So Haitians are not leaving their homes. The price of food has tripled or even higher. So there's some problems with starvation already in just 2 weeks. So it's a tough situation, and actually a wonderful opportunity for nursing and public health and for bright minds to figure out, well, how can we do this? So I chose tonight, given the great respect and love I have for Haiti, to talk to you about some of the models we can learn from in the past, and that perhaps to question and challenge, are we doing the right things right? And so the title is Henry Street, Hayden, Haiti, and the Golden Rule Jones. How many of you know about Henry Street? I'm curious. Yay, well, I hope. Yay, Lillian. So, okay, so let's go through. Is this going to work? Okay, so I think when any of us work anywhere, whether we choose to work in nursing or education, we have to have foundational values of why we are doing this thing. Otherwise, we kind of can go astray or get kind of caught up in minutia. So this is one of those statements that informs my practice and that has long been part of my journey. And I think it says it so very well. Of all forms of injustice, inequity in healthcare is the most shocking and inhumane. So that's just, I'm going to frame this a little bit. So here are my assumptions. I believe, and you can totally disagree with me, these are my assumptions, and the only purpose of global public health is health equity and social justice. I believe that the only purpose of a healthcare professional is to advance health equity and social justice. I believe firmly in the UN Declaration of 1948, Article 25. Are any of you familiar with that? And that healthcare is a right, and that women and children deserve special consideration. If you haven't had a chance to read through the articles of the UN Declaration for Human Rights, I encourage you to do so. But if you're interested in healthcare, please zero in on Article 25. I also stand by the UN definition of health, and all of our team, these are our founding principles. We don't make up what we think global health is. And we believe that everything is public health, and that health in all, anyone here familiar with that? Okay, so you've heard that. We've been working on that principle that everything is health, health in all, and that should inform our policies here in the United States. For example, transportation is health, right? Schools are health, etc. So everything is public health, and health is in everything. And that we believe that linear thinking is the enemy of problem solving, and that there is no ethic of good enough or better than what they had. That's not an ethic. And that Montana, being part of the globe, affects and is affected by global health, and that global health is not new, and that we do have a different type of global health. We're far more connected now, hence the new global health. But I bet if you asked a Taino Indian if there were any left in this world, if global health was new, when they were eradicated because of measles carried through colonialization. And I don't think it was the Roman neighborhood, it was the Roman Empire, right? So we have been interacting and colliding with one another always. So what are our ethics? What's our ethical responsibility in our world? And then unless, here I might get a little, I don't mean any disrespect to anyone, but unless you have a good return on investment, I'm not sure people are ready yet to go global. So you can agree or disagree with me on that. But here's what I hope that you might take away, is that you might notice where the 10 essential public health services have been used to successfully advance health, even before we knew they were called the 10 essential public health services. And I'd like you to see why we need to be scholars of our past in order to work faster towards a more equitable and just future. And then I'd also like you to imagine, after you hear a little bit about Lillian and Golden Rule Jones and Mary, and what might have they done with today's technology? What might they have been able to do? And what can you do with what you've got? And then to think about this idea of level 5 thinking and how we can carry this into global public health. The people I'm going to introduce you to that inform our practice, that are helping us to navigate this very complex issue of global public health in Haiti, and it is very complex, that we have to find things that worked, puzzle pieces that are out there instead of reinventing it. But it takes level 5 thinkers to get to that point. And I wonder what level I operate on some days. Sometimes I think I'm a 2 and a 3, and I have to challenge myself. The other assumption we make is that the social determinants of health are our definition of humanity and who we're working for. And not the old, I don't know how long you've been in nursing, but we used to say holistically a person was a mind, body, spirit. And that's a pretty limited view of what a person is. A person is all those conditions and circumstances within where they work and live, their communities, the type of house they have, the jobs they have available to them, the transportation, etc. So then our framework is built around these premises in our work in Haiti. So I'm going to share with you first a few stories. First, I'd like to talk to you about Henry Street in 1893, and then I'd like to share with you Golden Rule Jones, who was the mayor of Toledo, Ohio in the late 1890s. 1897 was when he got started. And then one of my all-time superstars that I've tried to think about and model my career after has been the Frontier Nursing Service in the early 1900s in a little community of Hayden, Kentucky, where there were some of the greatest disparities in women's and children's mortality rates. And then we're going to take a look at how this interfaces with the great failures of public health in Haiti. And just to let you know, how did I get involved in Haiti? Well, I'm I was nursing faculty, and I had developed some ideas for how we can do better at getting nurses and nurse educators being more responsible in rural and resource settings. We'd written a book, did all the things that I thought we were supposed to do. I was probably feeling a little like, time to buy a Winnebago. I've got this, I've done my contribution, I've done the thing I'm supposed to do in my career, and I was feeling kind of a little like, okay, I think I'll see if I can travel again. And so I threw a net to see where nursing was facing the greatest disparities in the world. 2 countries rose to the top immediately. Chad has 1 nurse for 15,000 persons, and Haiti at the time had 1 nurse for 12,000 persons. Just to give you a perspective on that, to have a nursing shortage in the United States is 1 to about 110. So you can see these countries are really suffering with access to a healthcare workforce. And then, of course, the education, the standards, the guidelines, etc. So I thought, okay, I've been learning some things, doing some things, I'd like to be of service. So I reached out to a few different entities and built a relationship with what was then the Haiti Nursing Foundation. And I was going to Haiti, I developed the syllabus, and I was going to go to Haiti to see what it would take to teach a public health nursing course in a country that was basically devoid of public health infrastructure and remains so today. There's little pockets of people doing things, but there's no systematic approach to public health at all there. And so few starts and stops, and I'll tell you the rest of that story in just a minute, how I went on to be involved with Haiti. Okay, so Henry Street Settlement, I'd like to share with you first what we might learn and what is so important about not forgetting our past, because what was done with the Henry Street Settlement in New York in the late 1890s was remarkable. So it was one of the best systems approach in a setting where there's mass urbanization, mass industrialization, and all of the ramifications of pollution, indoor air quality, high levels of poverty. And this was also an area of New York, if you're familiar with the 5 Points area and the gangs of New York, this was the Boundary Boys area. So it wasn't a friendly place. So Henry Street Nursing, it was first called the Henry Street Nurse Settlement. And as you can see, this is a typical homeless shelter at the time, or just a place for people to crash. There was huge, horrific rates of poverty, typhus, typhoid, cholera, all types of dysentery. Child and maternal mortality rates were horrific, and nobody cared. And anyway, so Lillian Wald, who was this very affluent young woman who had just finished nursing school, would just happen to be working there doing some heights and weights or something. Anyway, she is the one who coined the term public health nurse. And here's really a wonderful little statement. She believed that public health nurses must treat social and economic problems. This is long before we talked about the social determinants of health, right? Not simply take care of sick people. And that the public health nurse should be involved with the health of an entire neighborhood. Well, how innovative is that? We kind of have collapsed a lot of the work we do in healthcare now to silos, and we work within our own specialties as it's gotten more complex and more people. But this was a forerunner of this ethic of reciprocity. Okay, and so to improve living conditions here. So she started getting nurses to come to her nursing settlement because she came from a wealthy family. She had some backing. But what she has found, she said, is that the things which make men alike are finer, I just love that, are finer and stronger than the things which make them different. And that the vision which long since proclaimed the interdependence and the kinship of mankind was far-sighted and is true. Isn't that powerful? A lesson that many years ago is so profound and so important today. It's so important in Haiti. It's so important in things that are going on in our health systems and our challenges with the disparities and inequity in our country. So that was 1934. I'm not going to show you this video, but it'll be available to you. If you'd like to learn more about the incredible work what they did. This is called the Poverty Gap Playground, and you can see these children are barefoot. If you can just imagine the conditions, the rats, the cockroaches, and all the things that are going on here, the parasites that are in the soils, you know that this is a great public health challenge. Okay, so what they did, they figured out to get parks, children's education in kindergartens, schools. They put together dance companies and art. They took a total approach to the multiple determinants, the social determinants of health, to uplift and heal this community. A tremendously brilliant public health approach of the social determinants of health. And here is a nurse headed to a home, and she actually started the first home visiting in the United States, which has since gone on to become our home health agencies. So there was a model that was in a very, very complex time that worked. So I think about that and I think, okay, what Henry Street did was brilliant. It was tough. It was one of the hardest, most violent times in history, and they could make it work. What can I learn from Henry Street and apply it with all the great tools I have today to Haiti or any place else where you're choosing to work? Another place that is fantastically interesting, where child mortality rates were the highest in the country, both maternal and child mortality rates. And so now this is a model. Now, Henry Street was about industrial mass urbanization and all that complexity problem. Now if we look at Hayden, this was a different set of complexity problems of resource poor, long distances, and how do you get there? We work in a community of Fondwa, which we have to walk 5 miles to get just to one of the little, they call them habitations, to one of the areas. So how do you get resources? There's no power, there's no cell phones, only 2% have cell phones, etc., and there's no potable water. So this is a model we can look at today in resource poor settings. So Mary Breckenridge, she's actually credited for a great many of our public health and our rural health systems today. And then she had really great connections, and I'm kind of wishing I did too, because this is what helped her. She was actually related to a vice president and famous soldiers and came from a great deal of wealth. I want to just back up. One of the stories about Lillian Wald, she had gone, what really galvanized her purpose in public health was going to, a little kid came and got her and said, "Come help my mom." And when she got to this pretty rundown place, the mother was hemorrhaging, and she had lost her baby, and the doctor had left because the woman couldn't pay. And so it was what Lillian Wald went on to call her baptism by fire, what gave her her reason for wanting to slog through all this complexity, even when you go, what? This is just a mess. I think I'm going to take care of my life. So Mary Breckenridge had a similar circumstance. She went through amazing things, was a debutante, married lawyers. Her husband died. Quick story, both her kids died. She had married a second guy, and he wasn't a nice person. So if you can imagine in the early 1900s being divorced and widowed and lose your children. She ended up going over to France to help after World War II, which I guess was a total train wreck then. And she learned about midwives. And because she had a passion for children, she did kind of what we did through the map to see, well, where is it the worst? She found that Hayden, Kentucky was the worst for maternal child data in the United States. So she was determined to go there and help. And so when she came back, she started taking courses in public health. That was a little bit like, wow. One, for a woman to be in nursing was a big deal, but for a woman then to go into public health was an even bigger deal. But she learned by being a scholar to keep studying and keep advancing herself. So she created what was called the Kentucky Committee for Mothers and Babies. It was later renamed the Frontier Nursing Service. Now, if you can just grasp this idea, this group of nurses, and then she had to bring midwives from Europe because there weren't any midwives in the United States. They got on a horseback and they went all over the Appalachian Mountains and they reversed childhood mortality from the worst in the nation to less than a quarter the rate of the entire nation in less than 30 years. This is what public health is. And I go, okay, how am I going to do this in Haiti? When we've got complexity. People have figured this out for us, and we have got to be scholars. So anyway, it's pretty incredible what they accomplished. The Frontier Nursing Service still exists. And by the way, Henry Street is still alive and well and is thriving. It's a model that continues to thrive, and it does a Frontier Nursing Service. I was very sad to learn that I couldn't go work there and ride a horse, but they continue to do this public health, combination nursing, combination midwifery, and have remarkably changed the health and well-being of a population. And all of it attending to the determinants of health, not just looking at the illness model, but looking at, okay, poverty, housing, safe indoor air quality, water, etc., sanitation. And then this other guy that really impacts how I think about public health, how I think about global public health, and how I think about how dare I assume that I have anything to offer somebody else's country. I often joke around with my team. I thought, you know what, you guys ought to come and we'll set up a clinic on a corner in Missoula. And you're going to offer free health care, and you're not going to ask anybody's opinion about if you can be there. You're not going to get permission from the Ministry of Health or Department of Health here. You're not going to go to you're not going to bother with the Board of Nursing and make sure our licenses agree. I'm not going to get any permission. You just guys come over here. And they just laugh. They think that's the funniest thing in the world to do. Yet we do it all the time. We tootle right over to other people's countries. I had the privilege of meeting with the Ministry of Health in Haiti. It's the Ministry of Public Health and Population. And I tried to give them my license. And they said, oh, thank you, but nobody else does. So, and I thought, isn't that interesting? That's not an ethic of reciprocity, is it? So just thinking about that is, you might be guessing that the ethic of reciprocity is the golden rule. What I want for myself, I want for everyone. What my standard is for me, for my family, is for everyone. So this is our third piece. Now, Golden Rule Johns didn't mean to be in public health. He was a businessman, but he'd come from a very, very poor background. And here's what he thought as a business owner. So here's the business piece. Here's our partner and our collaboration piece, and how we integrate with public health across disciplines and get outside of our just healthcare roles. And he developed education. He had a band. He had he paid them fair wages. He gave 8-hour days. He had child care. He had health insurance. And if you might imagine at the time, how popular would he have been with the mega people of industry at the time? Can you imagine the big steel barons going, you're doing what? You're letting them work only 8 hours a day. You're giving them benefits. You're ruining this for us. Can you imagine? He did. He had death threats, and it was innovative, and it was the social determinants of health, and he had some of the most productive. Anyway, he was very successful in the mayor of Toledo, and while he didn't call it public health, it very, very definitely was from the business industry standpoint. So this was what was inside of his doors. You came into the factory. The rule that governs this factory, therefore, whoever ye would, whatsoever ye would that men should do unto you, do you even so unto them. I'm really glad I didn't live that time. I would have, ye and then thouing, I would have never done too well. But imagine if that were our principle inside every business, inside every public health office, inside our work in global health. How different might that be? The other thing that he did that made people mad at the time is he brought in prostitutes and gamblers and alcoholics, and he offered rehabilitation for them. So pretty innovative and pretty daring in a time when If we think socialism is being attacked now, I think it was pretty dicey country back then, right? So this ethic of reciprocity is what I want for myself, I want for everyone, versus this notion in global public health that it's better than what they had, or it's good enough. Have any of you ever heard that? And if you haven't, you will. People will be proud that they did, well, it was better than what they had. And I've certainly done that in global public health. But imagine if we change that language. Let's change that language from better than what they had to we're beginning. This is our beginning point, and this is our goal. Because if we stick with this better than what they have or good enough, we're kind of awarding ourselves, and we are creating mediocrity and not being Lillian Wald, and not being Mary Breckinridge, and not being Golden Rule Jones. So how does this apply to Haiti? Well, here's the rest of my story about my baptism by fire. And I have always, for whatever reason, maybe I'm a little goofy, but I've always noticed the underdog or when things aren't going well. And I've always been kind of a champion for health equity and social justice. For me and my worldview and how I think, it can't be any other way. It's not a gray issue. So my baptism by fire, as I was building this course for public health, it was going to be the first public health nursing course for baccalaureate education in Haiti. I was going to Haiti to see what it would take to teach a public health nursing course in a country truly devoid of public health. And so, as you may guess from this map here, that's where I was going. I was going to Léogâne, and it had the first accredited baccalaureate school of nursing in Haiti. And so I ended up there 40 minutes before the earthquake struck. And the epicenter of the earthquake was Léogâne. The outside world didn't know that. It's since been called the Léogâne Fault. But anyway, that's where I ended up, was Léogâne. And this has been my baptism by fire. And I can tell you, I don't like to belabor the subject, because it was a very, very, very sad, very difficult time. But I fell hopelessly head over heels in love with Haiti and with the people. And when I heard some of the news reports about what outsiders were doing, that just was so insignificant. The bravery, the courage, the kindness, the unbelievably hard work. And we didn't have food, we didn't have water. We had, I've found just the greatest use. I mean, breast pads are the most amazing bandages. And it was so simple, it was so raw. Listening at night to the whole area singing how great they are in French, and one aftershock after another, almost as violent as the earthquake. And seeing these beautiful people, this one picture is of this Sunday school teacher down there, and she thought I could save her arm. When you see something, I think we all have baptisms of fire across our career. Mary Breckinridge's baptism of fire was losing her children and falling into despair and trying to decide how she was going to be of service. And she chose to throw away everything and go work to help women and children in this remote part of Kentucky. Lillian Wald in the really dangerous community in Hayden, on Henry Street. And then Golden Rule Jones patented a thing and decided to go against the status quo to be good to people. And so if I could introduce you to the people I know in Haiti, the Haiti I know, you would have a baptism by fire as well. And I'm sure that you have each in your own life had different levels of baptisms by fire that have caused you to want to do something, that have changed the course of your life. So I went from kind of thinking the Winnebago time was coming to this. And I want to share with you this one statement, and if you carry away nothing from anything I have to say tonight, carry this. It is so hard, I will go with you. And if we will just learn to do that, if we will just learn to reach across not just our cultural and national borders, but across our discipline levels, that whether we're working with an architect or as someone who is really good at digging a water system or nursing or law or education, that it is only together that we can really impact significant change in these really tough places in the world. Now I'm going to take you to a place in complexity. Now I'm going to ask you each to imagine that you are a public health professional of some sort. And I am going to take you right now, and I'll give you whatever water and food. You're going to be safe. You're going to have security. You're going to have a driver. You'll have a mosquito net. So don't worry about your personal safety in any way, shape, or form. This is actually a pretty nice street in Haiti. So I'm going to take you right now, and I am taking each of you, and I'm going to drop you there. And your job now is to figure out what are the public health threats and what are you going to do about it. Can you imagine maybe what it smells like? You're near the ocean and then the trash. It's hot. It's muggy in Haiti. Looks like it had rained not too long ago by the clouds in the background. Can you kind of imagine being there? Would you start a clinic for hypertension and diabetes? Would you have a minor surgery clinic? Would you take in a dental clinic? Would you have everybody come together and clean up the trash? How are you going to attack this complexity? And I generally don't like to use the word attack or I'm going to fight AIDS or things like that, because I think St. Teresa said a very brilliant thing. She said, whatever we fight persists. She said, don't ever ask me to an anti-war rally. Ask me to a peace rally. So that's just a little aside. But can you imagine being here? And it's your job. You're totally responsible, and I'll give you the resources you need to fix this. Anybody have an idea where they would, I don't want to put anybody on the spot, any idea where you would begin? Do you see the public health threats in there? Yeah.
Like walk around and meet people would be where I would begin.
You're going to walk around and meet people and ask them what they think?
Or just hang out and then
I'm sorry.
spend time.
Spend time. Right. Okay. Very good. Very good. What public health problems do you see here? This is what our team's up against in Haiti, trying to make a difference. We're trying to create a Henry Street. Yeah.
I think before trying to do anything too specific, you need to focus on the environment. You need to first take care of pollution, trash, any hazards that affects the entire community, and then you can build to the specific details of what's more pathological, like hypertension or malaria or whatever. So that I would just start at the basics, because then everyone could assist with that.
Oh, great idea. Yes.
I would maybe try to start with the infrastructure and the government, and maybe getting some trash systems set up.
Good. And just to let you know how trash works in Haiti, it every now and again will get shoved to the side and it gets burned alongside the roads. There's no such thing as dumps or anything like that. Great idea. Yeah. So you're talking kind of policy, politics, infrastructure. Yeah. And your colleague sitting next to you, I think? Did you have your hand up?
No.
Oh, sorry. Okay. Well, thank you. Yeah, but you can understand the public health threats here, right? You know there's a lot of, there's rodents here, right? There's lots of mosquitoes here, right? And other disease-carrying critters. So obviously, and then of course, if we cared about, is smell pollution a thing? I know noise pollution is a thing, but for me, smell pollution is a pretty big thing. This probably stinks to high heaven. So you've got all this disease. This is a disease vat sitting right here. And of course we know it's contaminating the water supplies, and probably right. And then you look at the built environment. You've all pointed some of these things out already. Some of these places don't have roofs. And some of them look like another little rattle of an earthquake and down they're going to come. This is some kind of makeshift. Somebody donated some tarps or gave some away when an aid organization left and they no longer needed their tents. So they became a house. So you've got built environment, and you've got your natural environment. And if you start looking at, one of the things that I'm so impressed about is this street. This is fantastic transportation for Haiti. What Papa Doc did, if you're familiar for those dark years in Haiti, he actually destroyed all the roads and all the waterways so he could stop the movement of the people. At one time, Haiti was just this beautiful city in Port-au-Prince. If you look at 1950 videos of Haiti, it is a gorgeous city. Paved roads, nice cars, crosswalks, everything. So transportation, this is pretty amazing. There's a road with a drainage system. There's a nice car over there. There's such a collusion and a collision of things going on here, aren't there? And can you agree that this is pretty complex? And all we're talking about is one neighborhood. This is a pretty small area. So if we start asking ourselves, what is it we're meant to do in public health? What is the right thing? What is the ethic of reciprocity? It can be kind of overwhelming. So for me, I take a look at my heroes, Lillian Wald, Mary Breckinridge, and I go, wow, I get kind of scared sometimes running up against political powers and knowing that things can be a little dangerous. But how did Golden Rule Jones do that? So if Lillian and Golden Rule Jones and Mary did it, maybe so can we. And I'd like to just go over real quickly what these common themes are. So one, the ethic of reciprocity. What I want for myself, I want for everyone, and I don't cheat on that. I don't compromise, and I don't give way to mediocrity. And that is very difficult. They were scholars. They studied, and they used experience, and they kept developing their experience. They were systems thinkers, like what you've suggested. And above all, they were level 5 thinkers. And long before the social determinants of health were a thing, a commission at the World Health Organization, and long before, I don't know if you're aware, but the reason we talk so much about the social determinants of health in this generation is because Sir Marmont and the Whitehall studies in England. So if you're interested in that. And then, of course, we now have a framework of the 10 essential public health services, which are basically your job description for how to go to work in public health. And long before that, they were already doing this. So some common themes. So here is my baptism by fire. This first is a Sunday school teacher who thought I could save her arm, filled with gas gangrene and gangrene, and pink paint from where she had just painted her preschool. She had gotten all the preschoolers out, but she didn't quite make it. And then this gentleman in the middle, I don't know if you can make these pictures out, he waited on the ground for me for 3 hours. It was about 5 days after the earthquake. We still didn't have any outside aid. His arms being held together with cardboard. His hand was broken in many places. Humerus was totally fractured. And when I removed the dressing there from that little, this bendy part's called the antecubital fossa, when I took it off, it was still pulsating, bleeding. So he wasn't clotting. He was dehydrated, lousy nutrition, don't know when this guy, he never complained. He apologized. He apologized for bothering me. And then the one that really, well, many people like this, the one that really, oh boy, he came in on Saturday, and that's the malleus. You can see the end of the bone of his foot is sticking out in the bottom. There was nothing there. And he had gotten one bandage on Wednesday morning after the earthquake. And he was apologizing to me profusely. I am so sorry. I know you're busy. Thank you for working so hard for us, but I'm sorry. I think I need another bandage. I'm so sorry for asking you. Now, in what world is there an ethic of reciprocity in that? And as you can see, or maybe you can't, you can see the maggots. And as sickening as that was, to know what this man was suffering, I was glad he had maggots because that had kept the infection and was eating a lot of the dead tissue. But trust me, I don't think public health should be about my nursing skills being used to dig maggots out of a person. I shouldn't be doing that. What we learned from Lillian Wald, what we learned from Mary Breckinridge, and all the other people who have done this right before us. So we can pop up a tent like this. This is the Japanese International Cooperation Agency. So, ladies and gentlemen, I want to challenge you as you're moving into your careers and your life and whatever work you do, why can we do this and still have that? What are we not doing right? And I just hope that you get the idea that if we start changing our mind about global health being the ethic of reciprocity versus good enough or better than what they had, maybe we'll get this, look, there's a biohazard bag. There's gloves, there's medications. Look, they have masks, they have IVs. I had breast pads and working on the ground for these beautiful human beings that were apologizing to me. That guy's arm is wrapped with some torn curtains and cardboard a week after the earthquake struck. And it took, doesn't that boggle your mind that we can do this? We're fantastic at the aid. We're fantastic at drama. We're fantastic at dropping these big pods of many supplies. So how come we suck at the prevention? So that's our dilemma. And of course, you know, whether Einstein said this or not, can we stop doing what we've always done with global health? Can we break the mold and start forward? So just as a quick reminder, we have 3 basic levels of healthcare, right? We have public health, which I challenge you is health care. Then we have illness care, which is our medical model, and it is illness care. Then we have palliation, which is end of life. And there's some other levels in there in between. We have primary, secondary, tertiary prevention. We have primary, secondary, tertiary health care, and then quaternary health care, and then you can add, you know, like memory care and chronic cares in there as well. So if you work in healthcare, where do you focus? Are you going to focus in public health, illness care, or palliation? I can't work in Haiti without doing all 3. So how do we do this? What's the complexity? So I just want to, do they study the 10 essential public health services in your courses?
Yep.
Yeah, so you're familiar with this model. This is the job description, ladies and gentlemen, that Lillian and Mary and Golden Rule knew about. So how do we apply this? I want to implore that what we should do first is a community health assessment. We do then a community health improvement plan, which is with the community. Then we move to a strategic plan. Then we move to implementing it and evaluating it. And of course, always with this reciprocity in our values. So let's begin with evidence-based practice. Whether you're in engineering, nursing, public health, law, it doesn't matter. There are standards, guidelines, and ethics that you work by here in the States. Please carry those with you, because evidence-based is evidence-based wherever you are. And then, of course, the tool we use when we're working is Deming cycle. I'm sure you're familiar with that. But, yeah. Do you have a question?
Yeah, what did CHIP stand for again?
Oh, thank you very much for asking. Community Health Improvement Plan. And this is a short document, actually. The Community Health Assessment is a big document. I've got an example of ours here that we did, and there's 89 questions and took 3 years to complete. But the Community Health Improvement Plan then is taking your community health assessment and you condense it and you present it to the stakeholders and then ask them what they want, what's important to them. Like somebody said, you know, walk around, talk to people, get to know what they want. Work on their priorities, not yours. Okay, and then Deming cycle is don't just go in and do what you do, study it, think about it. Did that work? Is this the right thing? You know, any quality improvement project is about plan, do, study, act, do it again until you continually improve what you're doing. What if we approached global public health like this? Okay? And I just put this slide in here in case you're not familiar with Michael Kagan's 5 levels of thinking. He says, by the way, that most adults do not reach level 4. Yikes. And probably the best way to conceptualize the levels are those little circles over there. As you can see, level 5 is a highly mature adult who is capable of thinking across multiple dimensions, abstracting, and they're a systems thinker. And this person has to be deeply humanitarian and humanistic, right? So if you're not familiar, it's a great a frame. I have to remind myself, 50 times a day, okay, Michelle, you're being a level 2. But what if we start really using our human skills in a much more intentional way? So what we've done, we've created some models of how we work. This is our approach to the social determinants of health. This is our model of who is a person. And at the center is health equity and social justice. And so we don't look at just holism. We work on getting sewing machines. We work on getting clean water. We work on houses, etc. Because a person is not just body, mind, and spirit. And then this is our model for how, taking all of this, that we work in Haiti. And our compass, I want you to please think about what your compass is. But our compass, which I don't know if I can read it for myself, is increased life quality, contribution, and peace as the highest calling for what we assume is health and what our goals should be. And again, for me, my assumption is health, equity, and social justice in all things. So we've done a lot of cool things in Haiti. One of the things I'm most tickled about, that public health nursing course then that I did go back and teach. I got to partner with the University of Kentucky. It was just a hoot. But I've got to say, it was one of my most frustrating teaching experiences, because I was taking these students all over the community of Léogâne, trying to get them to get the concept of following the water. Drainage, potable, gray, and contamination. How could they get the concept of what was going on? There was actually a backhoe park there that I almost jumped on and started, but I knew I would have gotten in trouble for that. But anyway, we did a community health system, and two of the students ran up to me and said, "Wait a minute, you mean we can do something about that?" And I thought, yes, you're the only ones. That community, Follow the Water Community Health Assessment, went to the UN Health Cluster, and in 2014 a drainage system was completed for Léogâne. Do we know if it decreased the rates of cholera or filariasis or some of the other diseases? No, because there's no public health system. There's no surveillance. There's no registries. But that's a pretty cool thing, of the power of what you can be doing when you start thinking systems. And these are our breast health promoters. This is some of the work we did, community health assessment, just some of the things we've done and continue to do, but we don't want to be scattershot. So where to begin? I want to implore you, when you go, even if it's a small assessment, please don't make it an illness assessment. Don't ask how many people have high blood pressure or diabetes. Look at their full social determinants of health. And if you'd like a guide for really great how do you do public health step-by-step, the Public Health Accreditation Board, is called FAB, has all the standards and guidelines that match the 10 essentials. It's just an absolute guide to how you do this. So back in 2012, we worked with Johns Hopkins University and conducted research, did the community health assessment, the community health improvement plan, the strategic plan. We ended up working with the local team, and they said to us, nobody asks our opinion. People come in and leave, and they don't talk to us. So they said, well, why don't you guys start your own aid organization, and we'll support you. How about that for a model? So that's what we're trying. And is it right? I don't know. But Santé Combit Fondwa, we coach them, we give them supplies, we pay them, we give them the curriculum, we give them the tools, and then we show them how to do the work. And I don't know, maybe one day, because it's not our business. So we've taught Breast Health Initiative. Right now we're working on that as our systems approach. We've taught we've taught hundreds and hundreds of people safe water, first aid, Breast Health Initiative. But what we're doing here is training the trainers so that we are irrelevant, and to give them the skills for understanding how do they create their own Henry Street settlement, because I realized the question isn't right. It's not how do I create the Henry Street settlement, it's how do they create the Henry Street settlement for themselves. So what we have decided upon is what's called, of all the things from this community health assessment, from all these things we were learning, where should we begin? Well, you're going to say, well, Michelle, why are you working on a breast health initiative? What about childhood diarrhea or malaria or cervical cancer? Because these are the big guns, these are the big killers and the big money things in the world. The reason we chose Breast Health Initiative is because we've had the privilege of developing a relationship with Partners in Health and worked with Dr. Paul Farmer, because Partners in Health has the only evidence-based, standard-based breast cancer care in Haiti that is free. So we have a place to work with. So we asked the community what they wanted in our community health improvement plan. They were very concerned about how many of their young women die. By the way, in developing economies, it is young women who die of breast cancer, not old farts like in our country. So that means they leave children, and the rate is anywhere from 25 to 30%. And they mostly present at stage 4, which is not treatable. That's palliation and death. So I'm going to share a little bit with you about that right now. So these are two of the women. The first woman who really broke our heart, her name was Rosalind. She, as you can see, the tumors are rupturing through her chest and arms, and I can't even begin to imagine the pain. We couldn't even get her a Tylenol. The logistics, who had what, the supplies at the time, there was a lot of people running around doing stuff, but they guarded their medications. They wouldn't hand it out. You couldn't buy them in pharmacies. She didn't know what was wrong with her. She's 32 years old. She left 3 children, okay? And then this other woman, I don't know if you can see, she had a lumpectomy and no other treatment, and she had 5 children, and we were able to get her to Partners in Health, but it was palliation. All they could give her were narcotics for the pain. But at least we got her some pain medication, and she died, of course, shortly after. So we see these women presenting very late. We've got this opportunity. How can we build like a Mary Breckinridge, Henry Street, Golden Rule Jones thing with one thing to show how a system works? To teach the system and the infrastructure to Haitians. So it is theirs, it is not mine, it is not dependent on whether or not I come and go. It's not dependent on what I think or want. How do we do this? How what I want for myself, can they have this? This isn't what I want for myself. I doubt any one of you want this for anyone you know. So we've done the Breast Health Initiative, and what we're doing then is we've got 4 phases, and we're moving from primary prevention to palliation. We are building each and every step of healthcare with this. So primary prevention, secondary and tertiary prevention. We're building the systems and processes for primary, secondary, and tertiary healthcare. But right now, as you can appreciate, we're really on the palliation end. So what we're doing then, again, we got to do assessment over and over again. We're doing the community health improvement plan and strategic plan. We're talking, and our breast health promoters, we're trying to figure out, well, how can we fix this? How can we work with providers? And this is the system that we've set up. And so our phase 1 was, of course, training. It was a lot of planning and asking and understanding. It took a while to get the concept, because there's some voodoo and different ideas about what breast cancer is. There's a lot of, if a woman gets breast cancer, they don't want to say anything because their husband may leave them. People may think they're a bad person and they're being punished. And so we've got all the social stigma. So there was a lot of work just to get that part started. Then we started looking at getting our breast health promoters trained, who then went out in the community. They've trained, close to 1,000 women. And now we're kind of at this phase, because we have close to 500 women with potential positive findings. So we've got work to do. We have been working on phase 3, but because of the political conditions in Haiti, we're moving into evaluation phase for this next month, so we can keep our team safe. But the overall goal is to decrease breast cancer related deaths, and hope we get from this area where we're working only on palliation and see if we can't get upstream and start working on the social determinants of health. Nobody knows why women in developing economies get breast cancer at such young ages. And as a friend of mine said, it's probably a very aggressive type of cancer. So we've been working with this great group called Partners in Health and their university hospital, and the way the system works there is brilliant. We can send the women to the Zanami La Santé, which means Partners in Health in Creole hospital. It's up in Cange, and it's a beautiful campus. If you ever have an opportunity to go there, it's like being in an oasis. But the women go there for the initial intake, then there's a place for them to stay, and it's all free. Then they go over for treatment from Cange, then they go to Maribale, and they have this great focus, like Mary Breckinridge, on women and children. but they are the medical model end of things. So somebody's got to do the backfill of all these other pieces, so we're hoping that we can fill that gap. And just to give you a clue of how far apart we are, this is where we work in Fondwa, this community of 12,000, and Marabali and Kanj are way over there on the Central Plateau. It costs us about $50 to send one woman for treatment. But it's a little dangerous right now. We can't be sending anybody. But if you want to think of access to health care, we talk about our rural problems here in Montana. We got lots of them there. So where are we now? Well, we're still working with our breast health promoters and our breast health liaisons, and we're having them work on an in-depth evaluation during this insecure time. And we, of course, most interested in their safety. So things get built and then they stop in Haiti, maybe Hurricane Matthew, maybe political. It's complex, but if Lillian and Mary and Golden Rule could do it in some really tough times, I'm convinced that we can as well. I love this quote from, what's his name? Oh, Anderson Cooper. We are all as close as the wall of our hearts. And truly what I want for my children, I want for every child. And I just wonder if we start asking that better question, how you are going to change global health and move the needle more significantly. And I think that's all I've got. But thank you for your patience and for listening.
Okay, we have time for questions.
Yes.
How regularly do you go to Haiti?
Well, it depends on hurricanes. Usually twice a year. Haven't been for a while because one of our leads is at Virginia Tech getting his master's. It's very unhandy. It's really wonderful. We've also got a seed bank, an heirloom seed project. So we're trying not to be the ones. If I go to Haiti, it costs about $3,000 to $5,000 a week. That's a lot of money. And so if I take that $3,000 to $5,000, how am I best going to use it? Can I use it for wages for the team? Would that be a better use? So every time we spend $1 in Haiti, we want to make sure that it's the right reason. Going isn't always the answer. Now, that being said, we're at this point in this project where I need to go hang out there for a long time. I don't know how we're going to do that with the circumstances as they are. So I think a better question for me is we've got this resource. How do we best use it? Did you all see the nurses that raised $17,000 some to get a helicopter? That's a lot of money, right? So I don't know what they did for their return on investment. Okay, yeah.
Tell us a little more about what the circumstances are right now. I'm not sure everybody knows that, what's going on there that's preventing.
Well, it's a little complicated, but it's also a little simple. There was a lot of money lent to Haiti through fuel monies from Venezuela. And Venezuela isn't doing well. They want the money back. So that's a problem, and they're asking the people of Haiti to pay the money back. That's what the government is asking. They're saying, well, we're going to get the money from the population by increasing fuel costs and by increasing anything that can be taxed. And of course, the people are saying, I don't think so. And that's what's causing all the current riots. And it wasn't this presidency that blew through the money, it was the previous one. And if you want to know where the money goes to Haiti for the millions or billions, have any of you been to Haiti? Where did you go?
Port-au-Prince, Kenskoff. I've been through St. Mark, kind of up the west coast.
That's pretty up there, isn't it? A little nicer. Yeah, I go the other way. I'm like, ah. What percentage of the people on the plane would you say are actual Haitians?
From like Florida to...
No, I mean that are going there because it's their home. Would you say about 80% of every flight is like one of us with our T-shirts on, with our little logo?
Yeah.
Yeah, it takes, okay, you multiply, let's just take 10 trips into Haiti each day. Okay? Go out, you got a couple hundred people on the flight. You got about 80% of them are us. Now ask yourself where the money went. And that's why it is imperative when we start thinking, what do I want for myself? What do I want for others? What is my return on investment? Do I have any business going there? What am I doing? Should we be building houses if a Haitian can build a house? Or should we be showing a Haitian how to build a house? You know, should we be going in? Peter's heard me say this before. It's really very tough for me. The first time I went back to Haiti after the earthquake, the first time I went, there was nobody in the terminal. There was nobody. I mean, nobody went to Haiti, just a few people. And the next time I went, they had to get special concourses set aside just for all the people going to Haiti. Prior to the earthquake, about 5,000 NGOs, non-government organizations, or HOs, humanitarian organizations, were going into Haiti. After the earthquake, it's anywhere from 10 to 15 to 20,000 aid organizations. So I'm in this sea of people going to Haiti, and I'm not exaggerating. It was mostly high school kids. There was a whole bunch of girls with fuzzy pink pillows, too short of shorts, too low of tops, all their little iPod-y things and giggling, and I was confused. It was surreal to me, and I said, well, why are you going to Haiti? And one after another said, oh, we're going to go hold babies. I was like, oh my gosh, what are you thinking? You know, can you see that lack of equitable? I mean, no, we needed to send engineers. We needed to send people who could show Haitians how to do things. If we want to know what's wrong, we've got to look to ourselves and how we conduct ourselves. You know, and if I go in and offer a free clinic, I just put the physician out of business or the nurse practitioner out of business, because they're going to come to me. You know, it's the classic. If you've ever traveled in developing economies, you see, I mean, we're going to pick on evil Nestle, the big billboards that show a cute, chubby white baby and a really affluent looking European-style woman. And the logo on there says, if you want your baby to be like this, you will feed them formula. In a country where there's no water supply, there's no way to sterilize bottles, you know, and then we're killing the baby's childhood diarrhea because, one, they're going to dilute the formula because they can't afford, I mean, it's all just so crazy. So what I want for myself, I want for everyone. And how could we really move the needle because of doing that? So. Yeah.
Michelle, you mentioned something about seed project.
Oh, one of our projects is heirloom seeds. And I'm probably sounding like some sort of commercial here for anti-big industry. But Monsanto did intentionally go in. It's kind of what I call the Walmart economy. You can sell a whole bunch for a few pennies and make billions if you have enough people to sell them to. So they took in a whole bunch of hybrid seeds to farmers in Haiti and said, here, we'll give them to you for free. And sure enough, the first year, poof, they were big poofy plants. Well, you know that hybrids don't reproduce. And so it got mixed up and destroyed their native seeds crops. So if you look at the corn crops in Haiti, you go, what is that? It's this little pathetic, scrawny corn plant, or this little sparse bean plant. And so one of our team members, Junior, we're working with him on heirloom seeds to reintroduce and creating seed banks and to keep and reproduce seeds.
Fantastic.
Yeah, well, they are. They are. It's the people of Haiti. We just have the privilege of walking alongside. Yeah. Thank you for asking. Yeah.
I was curious with the breast health initiative, you mentioned the stigma being a big problem, and I was wondering if you found any really effective methods to address that, or like are there key people that have been involved, or do you feel like you've been able to make progress as far as addressing the stigma?
You know, that's such a great question, and we're not quantifying it, we're not counting it, but we're working with the guys. We're talking to the men. And fortunately, I have that kind of relationship with them. I can say, what are you thinking? You're objectifying that woman, but our team then, it's the hope. I mean, people say that some conditions are cultural. That's just hockey puck. Violence has never been cultural. Slavery is not cultural. That's just lunatic thinking. So we probably are messing up on cultural sensitivity, but we speak very blatantly to our male team members, who in turn are creating dialogues with other men. And some of the women have told us that they've said thank you. What it's going to change, I have no idea, and we're not measuring it. Yeah. But I probably just put my foot in my mouth all the time. Yeah.
Do you think it's environmental toxins that are causing the early cancer in women?
Isn't that a great question? We don't know. I have this crazy idea, but it's completely unfounded. This is going to be a little bit longer answer. Okay, so just quickly understanding trade, if you will. Okay, so a farmer in Haiti produces beautiful, if you've ever had an avocado in Haiti, that's an avocado. And the papaya and the nutritious foods, they can't afford to eat them because I can afford to buy them for $1. So I just price them out of being able to eat their own fruit, okay? So they get rid of their good stuff. And what they get in return is what we in all of our international trade would be the white flour, the white sugar. And one of the things that we give them is our surplus seed, wheat seed, so they can mill it into flour. Now, this is seed. This isn't meant for consumption. So if you understand about the way we treat our seeds with fungicides, and it seems they eat a lot of that. That is the only clue so far we found, is that they're consuming high amounts of fungicides in the processed seeds that we trade them for.
That just makes me sick.
Okay, but instead of sick, what I want for myself, I want for everyone. Let's not give in to complexity. It makes me sick too, I tell you. There are so many days I just pull the cover over my head and say, you know what? My big question some days when I'm being a little poo is, haven't I done enough? Come on. But that's the wrong question. I really don't want to win a bagel. At the end of the day, I really don't. So I guess we just have to decide where our part is. But I understand it breaks my heart. But I don't know that's the reason. That's the only clue we found. Yes?
I was curious how you adjust going back and forth.
I'm sorry?
I was curious how you adjust, like going back and forth, like coming back to sort of like a home space in the U.S. and then managing sort of the jarring.
Oh, that's such a good question. I am totally neurotic. Oh, I am. I'm physically ill. I've had the dengue and the dysenteries and the really creepy parasites and the so there's that physical piece, the physical exhaustion and the heat, and then there's the emotional pull. And I'd say, I don't think it was like post-traumatic stress after the earthquake. I think it was more post-injustice, inequity stress. And how do I reconcile these two worlds? And I went a little over the top. I literally gave everything I had to Haiti. Well, that wasn't a great move for me. But I guess I would do it again if something like that happened. That is a really important question for us to talk about, because I've talked to people who come back mad, blaming, or it's just so overwhelming that you feel helpless and you don't know what to do. And that's why I want to talk about stuff like this. I don't want to just tell you the stuff we're doing or show you gross pictures or stuff like that. But how do we solve this problem? How do we talk to each other and help each other to navigate this and to maintain sanity while we're doing it? Yeah.
Yeah, and then I guess maybe just sort of a follow-up. Since you've clearly decided like this is your path, how, like, there are just going to be bad days? Have you just accepted like this sort of a swing of some days are like more hopeful than other days, or have you managed to figure out how to self-regulate to a certain?
No, 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 no. I cry sometimes hysterically. And I get angry. I punch at the sky. I think this is creepy. I was sharing with Kelly about there's something funky going on. There's a whole bunch of mercenaries from the U.S. that landed. They got caught in Haiti with a whole bunch of weapons. What in the heck? How'd they get on a plane and get there and get in? Something was a little funky. And if I let myself, so I guess the reason I say that, if I start going down that little bunny hole, well, I'm pretty gray and I'm looking pretty old anyway, but I think I'll just kill myself and I won't be useful to anybody. So I find that one of the things I do as a strategy is pull into focus. And I focus on Lillian Wald. Like, well, what were you doing? I imagine what she was doing when I'm in those bad situations. And I imagine, I haven't gotten to ride a horse in Haiti, have you? They look really bony and painful. I rode a horse in Mongolia. That was so uncomfortable. So maybe my dream of, riding the backcountry of Haiti and taking health care to people is a little crazy. But I try to think of delightful things that would make me happy. Does that help? But please talk about that if you've done this kind of work, because it will, I heard Bill Gates said, don't give in to complexity. Don't do it. We're smart. We're level 5 thinkers. We've got tools. We have more tools than Lillian or Mary or Golden Rule Jones did. And look what they did. Yeah.
Michelle, I wondered what the status of the diaspora is in Haiti, and if it would be useful for you to work closely with people from the diaspora who are giving back to their country. And connected to that is, what's the status of Haitians in this country who had protected status for a while, and I believe that's under review right now.
Mm-hmm. Yeah. Our team member Junior is sweating bullets right now. They made him come up with $8,000, just a random amount of money to buy being able to finish his education. So there's a lot of slippery slopes out there. So to your first question about the diaspora helps their families mostly and helps internal businesses. Some of the aid organizations that are Haitian in the United States, it's called, let's see, what is there, how many? I could look back at that slide. But anyway, there's so many departments, which are basically states in Haiti. I'm just going to pretend there's 10. And the diaspora is called the 11th state or something like that, because there are so many Haitians here in the United States. I am working with some Haitian diaspora and on a microfinance business so they can help fund the farmers. But they're pulling away too. They're protecting themselves. Some are. It's kind of messy for that kind of path. And I'm not Haitian, so they want to work with Haitians, and that's as it should be. And then in terms of what's going on with immigration, I just would beseech each of you to study these matters. We are in a very bizarre and interesting time, and some populations are being targeted, and these are really good people. They're like Moise, he has Fondace, which is a microfinance group that I'm on his board, and we're working to try so we can get money to the farmers, etc. That's one of the determinants, right? Economics. He went to the University of Brussels and got his master's in finance, so he could bring that back to Haiti. Junior's working on a master's in agricultural development, so he can take that back to Haiti. The education doesn't really exist at that level in Haiti. So punishing these people and some of the comments I'm hearing. It's pretty frightening. I just would like to, I don't want to get too much into politics, but just, I beseech you to study this deeply and vote wisely. Yes, thank you.
You mentioned that you fell in love with Haiti. I'm wondering if you could elaborate more on how that happened and what the key difference is between Haiti and the other places you visited.
Oh, I wouldn't say I didn't fall in love with the other places too. I like people. But Haiti, if you can imagine, so I was going there by myself, and I was supposed to be meeting the president of the School of Nursing, who, just cut to the chase, she left us and went to the U.S. Embassy. She didn't ask me to come. She just left me there. It's like, now what do I do? Anyway, what that led to was me being with Haitians. My life depended on them. There was a Haitian on my right, Haitian on my left, and that was it. That was, I understood how you disappear from your life because it didn't look like things were going to go too well. And by the time, I think the first morning after the earthquake, it was about 4:30 in the morning. If you want to hear or see a scared cookie, I was like, what? Well, I don't even know where I was. Anyway, I was stepping over bodies. It was pitch black. And somebody touched my elbow. And in that slide where it said, "It is so hard, I will go with you," that's my Haitian son, Regan. And that's what we did. We didn't know what to do. We had no supplies, we had no food, we had no water. We had about 5,000 people with horrific injuries to care for. I put on a pair of gloves. They found some for me. I was so happy, and they disintegrated. And so we all were kind of thinking this was the end of our life. This was, we were all going to get HIV, we were all going to get whatever. And with, there was the tsunami warnings all the time, Leogans on the flats. And this one police guy would come running and saying, "Tsunami's coming, and we're all going to die." And it was like, well, rats. And so you come up with these dumb little tricks in your head. And you go, okay, I'll grab 2 kids and hold on to that fence. And when your life is like that and you see the goodness in other people, they were helping one another. They were giving me whatever food they had. They were giving me this orange syrupy drink that they loved, and that may have been their only food. They gave it to me. The man apologizing and thanking me. And there was one woman I had to scrub the gravel out of her legs. It was deeply embedded. I didn't have anything to give her but Tylenol. And she was, screaming. And I couldn't really, she shouldn't be screaming because there were people dying there. And so I went up and I sang her a little song and whispered to her. I said, "Please, shh, no, And she apologized and she said, "Okay." And she just started, I taught her Lamaze. I said, and she did it. And when you see the goodness and the grace of human beings under the most extreme conditions, you see who they really are. The way they helped each other, their respect and dignity. There's a couple buffoons, but there's a couple buffoons anywhere we live in the world. They were absolutely remarkable. And they believe another Haiti's possible. That's why I believe another Haiti's possible.
I think that's a really perfect spot to conclude on. It's a really very inspirational talk, and the conclusion to your answer to your question was particularly moving, I think. So join me again to thank Michelle for her talk. So let me just mention what's coming up next week. Next week, Dr. Phil Seidenberg is going to come to us from the University of New Mexico, where he's a professor of emergency medicine. He's going to talk about child health in Zambia, notes from the field where he's done his work. So we'll be really fortunate to have him come all the way from New Mexico, and I hope to see you all here then. And don't forget to sign in, either as a community member or as a student tonight. Thanks again.
I just want to thank all of you and wish you fantastic blessings wherever your life journey takes you, and your powerful heart of care and however you express that in this world. Thank you so much for letting me chat with you. Take care.
Thank you.